Welcome, everybody. Great to be here. Um, I guess she wanted me to start with just a little bit of my background. I am a chiropractor and I specialize in brain, spinal trauma, sports injuries, and 30 years I've been doing that. And along that way, unfortunately, my wife and I were in a head-on collision, and I was permanently disabled for quite a few years. And not going into great details, many surgeries, a computer implanted in my spine, and they basically put me in a wheelchair and gave up on me. And I fought really hard for a lot of years. I'm very stubborn as far as staying down. I believe that my body has the amazing ability to heal itself. And I just had to focus on the next version of my cells because these were damaged. I had a lot of damaged cells. And so I literally sought out everything outside the box. I'm a naturalist at heart. So if I can do something naturally and not need to use chemicals, I would try that first. Um, Therapies, products, I mean, you name it, anything, I was wide open to wanting to know answers. And so I found them and I found a breakthrough, then another one, and then another one. And it wasn't a matter of if, it was a matter of when. And so the year I got out of my wheelchair and started getting all my abilities back was the same year I met Sherry and Jack, and the same year I got introduced to ASEA. So when I thought about what is redox, when she asked me if I knew what redox was, I'm like, well, I understand the concept in the body, but you're asking me, I'm assuming you're thinking it's something outside the body, and I had never heard of it. And so that started our journey. And dealing with all these brain patients that are very limited on the amount of therapy they can do, we were able to really push the limits. And now we do way more than I could ever have imagined. And so we can squeeze 2 years of therapy into just 1 month compared to what we used to be doing. So it's changed my practice. It's changed so many hundreds of people's lives that we've dialed into. And now that I've moved to Florida, I retired from chiropractic almost 3 years ago now and focus on really understanding redox better. I love research. I love taking complicated things and making them simple for all of you. So this week, I was asked to do a call on the prostate. And in the last 2.5 years, doing this every week, we've changed the topic every week and never have anybody asked me to do the prostate. So I had to think about it for just a few minutes and think about, let me do some research first and see what I can find, how redox signaling molecules can possibly affect prostate function and all that it's doing. And oh my goodness, like anywhere in the body, if there's a cell, there's going to be redox involved. And we continue to learn so much about the body. And I feel that you just have to hear a different point of view, maybe somebody else talking about the same topic using different words. And sometimes you'll hear it in a way that it just clicks. And it's like, somebody just connected all the dots. I get it now. I don't know why I didn't get it before, but I get it now. That's my goal. So if I can help you learn about your body better to where you're more in tune with your body and you take better care of yourself, it's easier to make decisions if you have new knowledge. And then you can have some self-discipline about that knowledge and perseverance to stay to stay on course. So tonight's going to be about prostate. And it's really for everybody to know because as we mentioned in the beginning of the call, as Sherry mentioned, you're going to be alarmed at the numbers of how many people deal with this on a regular basis. So let me go ahead and start by sharing my screen. We will get rolling. So your prostate's hidden helper. We have so many little workers inside your body doing all the work, turning on and off switches, releasing fluids, turning the fluids off, digesting things, just metabolizing energy and food and oxygen, turning it into energy. All of this is a redox issue. So when we talk about the prostate, many of you might not know many things about the prostate. So that was my goal today. Now, we're not going to be talking about curing, identifying, diagnosing, preventing any diseases or conditions. We are ASEA, we are a supplement company. So we focus on how to supplement the body to heal itself better. And so all healing comes from within. Your cells heal from the inside out, although we're harmed from the outside in. So I hope you enjoy learning more about these amazing molecules and how they're affecting every tissue, every cell in your body, and all the function of your body. It's the language of the cells and how they talk to each other. So let's just first introduce you to the prostate. What we have here is an illustration of a bladder, and the prostate lies just below the bladder. Now, these two, I guess, stick-looking things at the top of that bladder, those are tubes that go to the kidneys. So the kidneys drain into the bladder, then the bladder drains out of the body. Now, this walnut-sized gland, it's wrapped around that drain that exits the body, the tube where the bladder leaves the body. And when it gets enlarged, it can pinch on things and interfere with the flow of urine in this case and create some problems. Now, right above that prostate and right below the prostate are two sphincters. These are what control the urine in the bladder to be able to eliminate. Now, there's an internal sphincter just above it, an external one just below it. And if the prostate gets swollen or big, it can push into those sphincters and make them not actually function right. Now, the prostate doesn't control these sphincters. That's important to understand. It's controlled by your nervous system. And so if it has any trouble with it, it's going to cause discomfort in the process of urination. And so maintaining the overall health of the cells in the prostate, including the prostate cells, becomes crucial. And that's where things like redox signaling molecules are going to play a very supportive role. So the symptoms when people start having prostate issues is usually frequent urination, especially at night, having to get up and go to the bathroom, maybe more than once. Maybe the urine comes out in a very weak stream, or you have a difficult time starting the urination. Now, those are sphincters that need to open, and it's unconscious. So it's not something that you consciously do. You just have to be ready to go, and there you have it. Maybe incomplete bladder emptying. So you can't empty the whole bladder and it's still half full, which means you have to make many more trips back to the bathroom. How about pain or burning during urination? And then in some advanced cases, you're going to get some bone loss, some weight loss, and bone pain and fatigue. Now, that could be common for a lot of people, but the most common issues, there's basically three issues condition-wise that happen to the bladder. And we're going to talk about all three of those and how they're different and what they actually do. So the first one is called BPH. This is benign prostatic hyperplasia. And this basically means an enlarged prostate. So BPH is all about the size of the prostate. And so as we grow, our prostate continues to grow. So think of like a balloon that's slowly inflating and eventually puts so much pressure into the area that it's interfering with the flow. Now, it's not cancerous, but it can cause some of the annoying symptoms with urination and so forth when that prostate is getting enlarged and squeezing on that. So the most common symptoms of BPH, we talked about these a minute ago: frequent urination, especially at night, weak urine stream, difficult starting to pee, and you feel like you just can't empty your bladder all the way. Now, the second condition is called prostatitis. Now, unlike the size where it's growing, the actual prostate gland is growing, this time it gets swollen, tender, and irritated. And so it's still getting bigger, but it's an inflammation issue in the prostate rather than a growth. And so this can happen due to an infection. And sometimes it happens and we just don't even know why. We can't pinpoint the exact cause. However, it's like your prostate is angry and inflamed and irritated. So the symptoms of this often include things like just pain and discomfort in your pelvic area, painful or burning sensations when you're peeing, frequent and urgent needs to pee, and then sometimes flu-like symptoms if there's an infection involved. So the big difference, the BPH, it's all about the growth, where prostatitis is all about inflammation. BPH is typically happening in older men, while prostatitis can happen at any age, even young boys. BPH onset develops slowly over time, where prostatitis can come on suddenly. And then the treatments of BPH sometimes it requires medicine, sometimes it causes surgery to shrink or remove parts of the prostate, where prostatitis is usually an antibiotic if it's bacterial in nature, or some sort of pain management. So remember that although these conditions are different, sometimes they occur together. And so if you're experiencing any prostate-related symptoms, it's always best to check with a healthcare provider for a proper diagnosis and treatment plan. Then the third condition we have is called prostate cancer. This is when the cells get damaged. They no longer are identified as my own cells, and they take on a whole new structure sometimes and certainly function. But in any case, we can see it's going to be doing the exact same thing, interfering with pressure into the two sphincters that are controlling urination, and then squeezing on that urethra. So it's really hard to actually get any urine out. And so you end up with a half full bladder, um, difficult peeing, all the same symptoms you're going to get as if you had the BPH as well. And so when we think of all three of those conditions, it's a very similar analogy. If you had a sprinkler that was watering your entire front yard, and then you drove up and parked your car on the hose, it's going to diminish the amount of water that's coming out. So if you have any type of growth or inflammation or even cancer, God forbid, in that prostate, the amount of pee that you can eliminate from your body gets compromised and it gets limited, and it can lead to all sorts of other symptoms and, of course, discomfort. So how do we know if we have such condition? Well, there's a lot of ways that they can examine you to kind of know that we're going into that direction, but the blood work is the fastest and easiest way because it can show elevated antigens for your prostate that are very specific. And if that's the case, it could be BPH or cancer. And so we know that within both of those conditions, we're going to have an elevated PSA. And so outside of that, they can do a physical exam and feel for inflammation. They can do a urine analysis and look for several different things through the urine that would warn us that you probably have this issue, as well as an ultrasound of your bladder just to see, do you fully empty it? So that can be very helpful. So there's several things that they can do to determine, yes, you probably have one of these things, but of course the blood work is the most specific. So always consult with your doctor. If you do normal blood work every year or a couple times a year, you'd be looking in the blood work for something called PSA. And that's obviously the abbreviation of this. And there's going to be a certain value there that's ideal for your age. And so just have your healthcare provider talk to you about that if you're out of the healthy range on the possibility of you actually having one of these conditions and what to do about it. And so let's talk about the difference now, the chances of you getting either one of those conditions, the BPH or the cancer. So for BPH, it's an alarming 50% of the men globally that are between 51 and 60 years old have it. To me, that's 1 in 2. That's crazy. I had no idea that the statistics were that alarming. And then once you hit 61, it jumps to 70%. And at 80, you're between 80 and 90%. So it's going to find most of us at some point in our life, unless we live the life that's going to prevent these things from actually happening. And so we'll talk more about that in a minute. But what about prostate cancer? Well, this is also fairly common, but a little less. It's not 1 in 2, it's 1 in 8 men will be diagnosed with prostate cancer in their lifetime. Now, that's still a very, very high number and unacceptable in my book. And so, what do we do about that? Well, the average age for that diagnosis for cancer is 66 years old. Again, far too young. So, what we do about that is we start to talk about cellular health. You can be chasing symptoms on the outside and maybe calm a symptom down with a treatment, but to get to the root cause of it, we have to change the body at the cellular level so that the tissues are healthier. And if the tissue is part of a gland, that the gland is healthier. And if the gland is part of a system, that the whole system is operating better. And of course, all of our systems create what we call an organism, which is us. And so our cells are the building blocks of our body. Now they're 200 times smaller than a piece of hair, thinner than a piece of hair. So unfortunately, they're so tiny, our eyes can't see them without magnification. But there's a whole world going on inside our cells. In fact, one of these days I'll do a talk just on the human cell because I used to teach a several-hour lecture on the human cell, and it is fascinating. But that's the building blocks for our body. So a healthy cell equals healthy glands. I mean, that's what it boils down to. If there's a gland or an organ or a tissue that's not healthy, it's because the cells aren't healthy. And so we heal things from the cellular level. So cellular health is absolutely crucial to have a properly functioning prostate. So how do we do that naturally? Like, what does our body do to make that happen? Well, we produce something called redox signaling molecules. And for those of you that this might be a new term for you, think of the periodic table, which means these are all the elements and all the molecules on the planet that make up every piece of matter. So anything on the planet, if you break it down into its smallest molecules, they're going to be on this chart. And if they're not, it means they came from off planet, from another planet somewhere. And so these are the raw elements of what we're all composed of, our bodies and in this whole, every piece of matter on the earth. And so when we take some of these are considered redox molecules because they're actually very highly active, reactive molecules. So we're making them to neutralize threats. So they're very active molecules. They're super tiny because it's as small of a particle or molecule that you can get. So it doesn't break down any further. In fact, we use all these redox molecules to build up antioxidants, different combinations of different ones create different antioxidants. So it's all just a dance of energy at the cellular level. And the electrical exchanges between these molecules is how the cells communicate. It's how they actually talk to each other. And so cell signaling, gene expression, and your immune response are all driven by redox signaling molecules. Well, why is that important? Every cell in your body has them. It maintains what's called cellular homeostasis, which is balance between all the functions and all the chemistry and everything that's going on inside that cell. It's designed to maintain that balance. This little orange jelly bean looking thing here is called a mitochondria, and we might have hundreds, we might just have a few, we might have hundreds, or we might have millions of these in our cells, depending on which type of cell is it. But they all do the same thing. They convert food and oxygen into energy. Energy comes out as ATP and redox signaling molecules. ATP charges the cell, redox molecules communicate. Think of them like the workers in the cell that are keeping it clean, keeping it maintenance, doing repairs, communicating to everybody else in this cell. And then they have the ability to communicate to all the cells next to them so it can create this whole cascading effect. So it's maintaining homeostasis inside the cell and out. activating antioxidants and supporting the repair mechanisms within the inside the cell, and then to facilitate cell-to-cell talking. And so if we didn't have the ability to do that, we would be taken out by whatever pathogens and things we breathed in their very first breath. The fact that our body knows how to identify, wall off, and protect the body from that running around causing havoc, and then that same intelligence knows how to get it out of the body when it finds the pathway and the resources. So that's innate intelligence, and that is redox signaling molecules. It's the redox molecules that they send the information with and that are turning on and off everything. So think of it like all the staff in the building are the redox molecules. The building is the tissues, and all the functions of the lights and the utilities and everything, those are our systems in the body. And it's the workers that need to activate and turn everything on and off. So redox molecules in your prostate health, well, first of all, it's going to support the overall prostate cell function. They maintain balance in the cells, they make energy for this prostate cells, and these are also the molecules that are responsible for cell division and cell growth. So when it is time to replace all of them, these prostate cells, it's redox molecules that are transcribing the DNA to put it into the new cell. So it may help reduce inflammation. Well, chronic inflammation is also lead to prostate issues. And redox molecules can modulate that inflammatory process and response. They may assist in reducing oxidative stress, which is a key factor in inflammation. Oxidative stress is the wear and tear and the waste product of making energy. We all make a lot of oxidative stress in our cells, and we're exposed to pollution and toxins and pathogens and things that create a lot more oxidative stress in us. So we produce antioxidants to put out the fire of oxidative stress, let's just call it. Now, if our oxidative stress gets too much and we can't neutralize it with our antioxidants, that's when inflammation gets called in. So inflammation is secondary to oxidative stress. Now, inflammation should get in there, inflame it, flush everything out, put the fire out, and be over. And then inflammation turns off. But if it doesn't turn off, now we're having these chronic issues, which could lead into autoimmune issues as well. So the potential to support our natural defenses from abnormal cell growth, that's also a redox. It plays a huge role in, let's say, quality control of our cells. And if it sees that a cell is damaged beyond repair, it'll trigger something called apoptosis. And this is programmed cell death. And so it doesn't want to let a mutated cell that's not my original prostate cell reproduce itself. That could become very dangerous. And so redox has the self-destruct button. It basically will hit the self-destruct button. The body says, okay, this cell is no longer viable. We're going to kill it and let the new one come in. And so that's an immune function process. And so besides just doing that, it's crucial for preventing the proliferation of all these potentially very harmful cells. Talk about angry cells, talk about that third condition that we spoke on. The fourth thing is it's going to aid in maintaining healthy cell metabolism. Now, cell metabolism means making energy, which is essential for prostate health. Redox molecules can support that efficient nutrient use and waste removal. We talked about the workers in there. They're cleaning up and they're taking the garbage out, okay? Helping things work a lot more efficient. They're also helping maintain the prostate's cellular environment, okay? And so all of that metabolism needs to be dealt with, and all of the waste products of that needs to be dealt with, or we have more problems. The next thing is it's also enhancing our cellular communication. I can't stress how important that is to understand. A cell is just a cell, and if it can't communicate, it's not going to be able to defend itself very well, and it's not going to be able to tell everybody else how it died so that they can adapt and actually protect themselves. So to enhance cellular communication, it's like good cell-to-cell communication, good cell-to-cell communication is actually vital for any of our organs to function. And redox molecules act as messengers between the cells. So this improves communication and supports our overall prostate health. And then the last thing was the DNA repair. If we do have damage issues, damaged tissue, and we're having all these symptoms, it's redox molecules that transcribe the DNA into the new actual tissue. So DNA damage is going to lead to all sorts of prostate issues. And it's the molecules of the redox that are responsible to repair it. And if it can't repair the DNA, it's going to replace it. And it'll make billions of copies of that DNA to find the cleanest one to get into the new cell. So it can technically find a younger version of you and bring that to the present. So what about age? This is a very important concept to understand because we can understand how amazing redox is and how important it is and how we wouldn't even be alive for 3 minutes if we didn't have it. However, our bodies age, and as we age, we don't make as much. We lose these mitochondria with age. In fact, 1% of them every year. So a healthy cell needs to have an electrical charge on it. If it doesn't have a charge, it can't communicate. We're bioelectrical beings. Now, preferably 70 to 100 millivolts. Now, if I have any condition, it's going to be less because all the symptoms and conditions that we live with steal away some of that battery and some of that charge. So if we think of our cells like actual batteries, when we're young, we have a full battery. We can abuse our bodies and it's no big deal. We can keep going and respond and have resiliency. But after middle age, we're about half charged at best. Our batteries won't go any higher than that because we just don't have the ability to charge them more than that. And as we get into our elderly years, you could be down to 20% of your battery once you hit your 80 mark. And so where's the other 80%? That's why you don't have the body and the reflexes and the speed and the strength that you did when you were 20 because you just don't have that resilience. And then God forbid you run out of redox and you're going to be forced to be on life support where they actually plug you into a machine in order to keep you alive. So your risk for increased prostate issues goes greatly with age, as we said, because you just don't have the potential to keep it clean, to keep it functioning right. And so we're sacrificing. Now, the beautiful thing is we have ways to reverse this. In fact, ASEA has redox signaling molecules stabilized outside the body. Now, the ones in the body are gone in a trillionth of a second. As fast as you can make it, you're using it. You don't make this and store it for when you need it. You just make as much as you can at any given time. And certain times you need to make a lot more, other times you don't. But this supplement has the ability to change the potential in your cells. Now, it takes time to do that. It's not instant. We have a gel that's twice as concentrated. It is instant. But in talking about prostate health, this is something that we need to increase the tide of redox in all cells. So slowly raise that tide. The more you have in there, the better it functions and the more resiliency it has to fight against the things that are trying to damage it. It's going to support our body's natural processes. It can never make any cell do what it isn't already programmed to do. And you can't overheal anything either, which is important to understand. So there's no toxicity. You can have any amount of this. If you can't utilize it, you're just going to eliminate it. So there is a sweet spot for each person, depending on your age and how many issues you're dealing with health-wise. But it's important to understand that this is going to take a little bit of time of consuming it before you see the results. In fact, 90% of the people will have a major breakthrough within the first 90 days. But in the first week, it's only like 10%. In the first month, it's about 50%. So keep in mind that it is impossible for this not to benefit you, only because it's native to the body. These are the exact molecules that each one of your cells are making to repair, to grow, to strengthen, to communicate. And so it's native to your body, which means you make them. which means I don't have to break this down and digest it. It's already come in a very stable form and it's going right to wherever you need it instantly. So it truly is an alpha product. I take this before anything else. And if I had to stop taking anything, this would be the last thing I stop taking. This is the most important supplement that any of our bodies could use to literally thrive on. It's going to restore the potential that aging takes away from you. So that's really important to understand. Nobody's immune to aging. Now, granted, some people age gracefully because they take good care of themselves and they can live a very healthy life to the very end. Other people ignore it and think, if it's not broke, don't fix it. And they slowly decline until they're on all sorts of medications and all sorts of hospital visits. And their quality of life is just so minimal to where it once was when they were thriving. Well, let me tell you, we can thrive at any age of your life. It takes work, it takes some discipline to be consistent with things. But if you went to your doctor today and he told you that you have an enlarged prostate, well, and you're like, well, I don't know if I want to really get on any medications. What are my options? What are things that we can do? The things that you would do is number one, redox signaling molecules. Nothing will help improve the health of your tissues, any tissue in the body for that matter, faster than redox. It's what your body uses. This is as far upstream as you can go to get what your body is going to create to fix the problem, no matter what the problem is. The second thing is a diet. If you're eating food like you see in the picture here, you're going to thrive because you're going to be able to make so many redox molecules and so many antioxidants out of your food. You'll actually make more redox for your body by eating this way versus eating junk food. It's costing you a lot more redox to break it down than you were making from it. And so you have to pick your battles. Exercise, a body in motion stays in motion. Your brain produces endorphins that excite all the cells and just help everything function better. So if you're not being active and moving often, it's going to affect you. So if you want your prostate to be healthy, you want to make sure you're doing a lot of regular exercise and of course manage our stress. People that hold on to stress and just don't communicate with people, it's like a time bomb ticking away inside of you. Stress is going to be a silent killer in so many people's lives because they don't know how to manage it. And stress depletes redox from you so fast. Remember, you can only make so much. So if you have a lot of stressful events, it's going to take you out for the rest of the day. You want to just go lay down and sleep or just lay down and relax. I can't work anymore. So stress management is super important and adequate sleep. If you're not sleeping, you're not healing, you're not repairing. It's the repair that takes place during that deep and REM sleep. And if you're not doing it, you're not just going to make up for it on the weekend when you sleep in. You're causing harm every day that you're not sleeping. And so getting the sleep is super important. And then regular checkups with your doctor to monitor your levels. And so we can make sure that if you're trying to do the natural things rather than the medication route, that we're actually getting results. So you don't just do things blindly because somebody told you to do them. You do them because it makes sense and you know why you're doing it. And then you also know how to validate and check that it's actually improving to justify why would I want to stay on something. Okay, so all of that plays such an important role. But here's another thing. So many physicians now are learning about redox and they're every platform, every different type of doctor has a fit for how redox can um, work with the technologies and the medications and the surgeries and the things that they're doing to help get better results. So integrating redox molecules supports conventional treatments too. Remember, this is how our body communicates and functions. So if it communicates and functions better, I might need less of that medication because I'm identifying it. I can break it down better. I can utilize that better. It can get absorbed better. And this also gives people to have a personalized approach based on your actual individual health status. So everybody's going to have different things going on with your health. And when the physician understands redox and they can implement them together, it's a beautiful relationship because now we all know that you're going to get better faster and actually stay well. And isn't that, after all, what every doctor should want on their scope of practice? What's your main scope of practice? To get patients better and keep them well. How wonderful would that be? So we have these two products that allow us to introduce redox signaling molecules into your body. The ASEA Redox is the liquid. And so we take this and we use a shot glass, either glass or plastic. You're going to take 2 ounces at a time. You're going to put it in your mouth and swish it around in your mouth for 15 seconds. And 85% of those molecules are already absorbed systemically, which is amazing. And then you just swallow, simply swallow the rest. Now you can also spray it in a spray bottle directly into your eyes and improve your vision. Do that multiple times a day. You can spray it right on the skin in any open wound. There's no toxicity, no amount is dangerous. And so this is an absolutely safe product for any part of your body because your body's making, every cell in your body makes these. And so it knows exactly what it is. And there's no toxicity level. Now for the Renew 28, this is twice as concentrated as the liquid and it's in a gel form. So now we can actually get the instant results. So things like prostate health, you could rub it right below your belly button, right below your navel, so 2 or 3 times a day. You can also put it into an applicator and go internal right where the prostate is and release the gel internally, or even the liquid for that matter. The gel will be more powerful. And so outside of that, it's any cut, burn, sting, rash, blister, open wound, you're packing this Renew right into it, and it's going to stop the bleeding, it's going to reduce inflammation, and it's going to help your immunity understand what's going on a lot faster. Remember, these are the workers in there. When you have any type of injury or chronic condition, redox molecules are always in there talking about to the brain, hey, this is the damage I got here. I got an assessment and I need this kind of tissue and that kind of tissue to do some repair. And can you please bring the waste removal company? Because we got a lot of debris in the streets over here. So it's redox molecules that manage construction of new tissues coming in, debris and bad tissues going out, and then dealing with the immunity so nothing can sneak into this wound while we have it. And so redox molecules are going to deliver more power to literally every cell in your body. There is no greater gift that we could give our body than to bring back the potential that we had when we were just young. And that to me is worth the price of admission. There's many products that I've found over my 30 years of my career that were breakthrough products. Boy, people really had amazing changes physically, emotionally, mentally. And then there's patients that didn't respond every cell in your body makes. So it's impossible for it not to work. In fact, it's so reactive, it takes seconds after a touch issue to where it's already in your bloodstream, taking things to where they need to go for complete and utter healing. And so the healing only comes from within. We can't take something outside that heals us. It doesn't work that way. Healing starts at the cellular level that we just spoke about. And it's the molecules inside that cell that are initiating all the transcription of the DNA to make a new version of it. So, like I said before, it's as far upstream as we can go to where healing starts. Your body starts producing more of these molecules, and then it cascades into whatever the condition is that needs help, healing, repairing, managing. All of that comes pretty easily when we have these amazing resources that we can add into our system. So that's it for today for prostate health. I hope we all realize that we can actually improve that prostate health. And I don't care how old you are, and I don't care how many times you've been getting up to go to the bathroom. We start taking care and using that gel in the right places and drinking it and consuming enough. The biggest problem that people have is they don't take it consistently and they didn't take enough. And so this is something that's just as important as water that you have to drink every day or you'll start to deteriorate away. Okay, you need to eat food, you need to drink water, you need to sleep. Well, we need redox too. This is one of the most important needs that our cells would cry out for. And so many people that have been struggling with symptoms and health challenges for their entire life, some of you decades, some of you just years, all of that will stop once you get your resilience back. And once you get that energy levels of your cells, now all things can happen. The cell has no energy, it can't defend itself. Simple things will just come by and knock it off track and cause all sorts of havoc. And then you have all sorts of other symptoms. We want to thrive and we want to be the best versions that we can be. And this is certainly the first product that I would put everybody on. You know, in our practice, a SIA is where this starts. If you're not willing to do a SIA, that means you don't really want to get better and you don't want to do it faster. I want to save people money and help them get better faster so they don't have to spend as much to get better. And then maintaining it is easy. And so I hope that moves somebody today. I hope you're willing to try this if you have any of these symptoms. And I'm super excited about the results you're about to get because I already know the end and I know what it's going to do. I've seen it so many times and I expect these things to happen. So I wish you the best of your health and, uh, and for your family. So I'll pass it back to Sherry. Thanks. Everybody have a great day.